You are welcome to my channel. Today I'll be addressing possible complications of hypertension. There may be bleeding or stroke if there is high blood pressure and is not under control. That might be leading us to hemorrhagic stroke or intracranial hemorrhage, subarachnoid hemorrhage. There will be classical presentation of that, or epistaxis, that is nosebleed. I've seen that before. And it could lead to ischemic stroke. So hypertension that is not under control could lead to stroke, either hemorrhagic or ischemic. There might be hypertrophy. Hypertrophy of what? Of left ventricle. Left ventricular hypertrophy. There might be hypertensive cardiomyopathy. So that will be obvious through EKG, CT scan, chest X-ray, or echo. There may be ischemic heart disease. That is a possible complication. Then heart attack, that is myocardial infarction and acute coronary syndrome. Remember, that will be made of ST elevated myocardial infarction, non-ST elevated myocardial infarction, and unstable angina. Long-standing hypertension can eventually lead to a failing heart, and we'll be dealing with heart failure. When high blood pressure is right there for a long time and not brought under control, that may destroy the kidney from glomerulosclerosis, then progressing to renal failure and chronic kidney disease. With time, hypertension that is not brought under control would damage the artery. The artery could become thickened, atherosclerosis will set in, and aneurysm can occur, and with time, it can dissect, can tear up. So aortic dissection is possible. Memory could become impaired, and there might be seizures. So there might be vascular dementia or mild cognitive impairment before full-blown vascular dementia. Then there might be seizures. The eyes or ocular system will be seriously affected if high blood pressure is not brought under control. There may be visual difficulty with blood vision, and we can be battling with hypertensive retinopathy when retina is damaged. Also, when the optic nerve is damaged, we'll be dealing with optic neuropathy, and that can lead to blindness. Reproductive system is not spared when it comes to complications of hypertension. Men may suffer erectile dysfunction. Women can have decreased libido and vaginal dryness. In pregnancy, hypertension could now give a serious problem. We all know about preeclampsia, right? When it is not properly managed, it will progress to eclampsia, and that might lead to the death of the mother or that of the fetus, or both. Complication of hypertension will reach the lungs, and there we'll be dealing with pulmonary edema from blood flow. The chest will suffer chest pain, and then we'll be looking for probable cause or causes of that very chest pain. Now finally, hypertension that is not brought under control will lead to complications known as hypertensive emergencies. In hypertensive emergencies, there will be high blood pressure with signs of end organ damage. That will include left ventricular hypertrophy, stroke, hypertensive retinopathy, chronic kidney disease, hypertensive encephalopathy, and so on. And there might be arrhythmia. And then the affected person, if no correction on time, can go into coma. And from coma, there may be sudden death. So, hypertension is not expected to kill if we will comply with pieces of advice from the physicians and take the prescribed medications appropriately. But we can run into all these problems and even die. So let's follow the instructions. It might be difficult, but it will help to keep us alive. With this, I've come to the end of this very presentation. Remember to subscribe to my channel. Remember to share this very presentation to help everyone already diagnosed with hypertension. Thank you.